Hey, I'm Dave Esposito. I'm a board-certified vascular surgeon working here at the Milford Vascular Institute. And today we're going to talk about a patient who has suffering from venous disease. Patient's a 60-year-old healthy female who came in to us for evaluation of leg swelling. This is a pretty common complaint for a lot of people, but in this patient, it was mainly her left leg swelling. So anytime patients have one leg swollen more than the other, the first thing we think about is blood clots. Here at Milford Vascular, when you come in, you'll get an ultrasound right away at the visit, and we did that, and she did not have any blood clot. Second thing you think of is that maybe there's something called iliac vein compression, which is also known as May-Thurner Syndrome. And this is a process that happens. It happens in females more than males, where the iliac vein in the pelvis can be compressed, and it causes basically a blockage in the blood trying to get out of the leg. And so in this patient, we diagnosed her with that, and today we're going to bring her into our office-based laboratory where we can do some minimally invasive testing, find out if that's the case, and if it is, we'll fix it. What we do is we go in through the groin. It's all done through a needle hole. We do it with a little sedation, so most patients sleep through the whole procedure. It's not painful. And by going into the vein with a needle, we can then inject dye. The dye allows us to see if there's any blockage. And then we can also perform what's called intravascular ultrasound, where we can put an ultrasound probe into the blood vessel and get a 360-degree view from inside the blood vessel. If there is a blockage there, we can do various things. We can blow up a balloon inside the blockage and try and open it. But typically in May-Thurner, because it's an external compression, typically when we stop and deflate the balloon, the compression will just come back. So typically in these cases, we'll have to leave a stent. So what a stent is a metal tube, okay? And this is the exact stent that we would use in a vein. This is a lot less, it's a little more flexible than stents we use in arteries. And you can see that it can bend, which is important because we're putting in a place where there is going to be some bending. And so this stent will go in, but what it'll do is it'll hold open the blockage. So that compression now is being supported by this stent. So not only will the blockage, the compression be relieved, but it will stay relieved. And so this stent stays in there, it'll stay in there forever, and it'll hold that vein open, so now the leg can drain, and typically within 6 to 8 weeks, the patient's leg swelling should go away and stay away. So that's the case you're about to see, and we can talk more afterward. All right, take care. Thank you. So this is a venous case, so we're going to start with venography. So typically in here we usually work on arteries, on block arteries, but in this case we're going to be looking at a vein. And what we're looking for specifically is an iliac vein compression syndrome, which is also known as May-Thurner Syndrome. Basically what can happen is an artery can push down on the vein and cause basically an obstruction of that vein. And what happens is, as the veins are trying to bring blood out of the leg to the heart, that becomes very difficult. So what happens is the blood stays in the leg longer than it should, can lead to leg swelling and all the conditions that go along with leg swelling. And it's important to have a kind of a high sense of suspicion when you see someone with one leg swelling. When it's a woman, when it's their left leg, you always have to think of iliac vein compression syndrome. Typically you can use venogram to diagnose that. You can get a CAT scan to diagnose that, but eventually they may come to the interventional radiology suite here, where we can perform a procedure to not only diagnose May-Thurner syndrome, but also treat it if it exists. So we're going to get started here with the venipuncture, and then we'll take some pictures and we'll go from there. So in this case, we're injecting dye into the common femoral vein. As it comes up here, this is the common iliac vein, external iliac vein, into the IVC, inferior vena cava. You can see some refluxing down into the right side. So this is, the black is the blood flowing back to the heart. So typically the compression will occur in here. As you can see, it doesn't look like much on this. The problem is, venography, angiography is a two-dimensional study. And especially in May-Thurner Syndrome, the compression is from the top. And so what happens is the vein gets pancaked. So when we look at it in two dimensions, it can look nice and big, but that's because it's being flattened. And if you look at it in the other way, you can see that it's compressed. So the way we get around that is we're going to use something called Intravascular ultrasound, or IVUS, which is where we can put an ultrasound probe into the vessel, and then we can get a 360-degree, three-dimensional picture of the inside of the vein. We can see if it's being compressed. We can measure that compression, do calculations. So this really has revolutionized the diagnosis and treatment of May-Thurners. Got it. Okay, so these are the pictures for intravascular ultrasound. We're going to start up in the inferior vena cava and then back our way down through. So,
ready?
All right. So this circle here. So the black circle in the middle is our catheter. Then you can see we're in the inferior vena cava. We're coming down.
Her whole IVC and iliac vein are somewhat compressed, but we'll have to look at the total area to see if it's significant. We also have up there
so you see how this, instead of being a big black circle there, is being compressed there. It's just like a pancake. Okay? So what we're going to do is we're going to measure it and see the degree of compression. Comparing the area of the compressed segment to the open segment, you can see this tells us there's 62% stenosis from that external compression. So the iliac artery that's compressing the common iliac vein, 62% blockage, and you can see how pancaked out it is, and that's why when you look at the angiogram, it looks wide open, but that's because what we're seeing is that pancake portion.
So what's the, so make sure there's a real place.
So this balloon, we're gonna put a balloon in there and expand it in there and just confirm that there is a blockage. See how it responds to ballooning. So here's the balloon. You can see the two markers. So the balloon's going to expand here. We're going to see how the balloon reacts. So it's inflating. That balloon is 16 millimeters diameter. Do you feel it? You feel anything? We stretched it with the balloon. We're going to go back in with IVUS and see how that responded. Based on what we see, we may leave it with the balloon. We may put a stent in. We always have the option to come back and put a stent. So if it looks good without a balloon, we'll try and avoid putting a stent in if we can, so they don't have to have a foreign body inside them or things. So we always have the option to come back and put a stent in another time if it occurs.
don't know if you could see compared to the other one, there's less reflux down the other vessels, so there's less blockage. Let's measure again. Go back to the IVC. Go to the IVC. I want to see. Right there. That's it. Now measure your health.
We ballooned it and it's basically unchanged. So we're going to probably put a stent in there. So this is a stent. So inside of here is this metal tube that we'll see will deploy and it'll kind of open up from here. Stents are metal tubes that hold open a blood vessel. They have radial strength that force out against the wall. They get kind of wedged into the vessel and they press and they hold the vessel open, whether it's an artery or a vein. In this case, it'll hold the iliac vein open.
Okay, so you can see the artery going over the vein here. See it? So
This is the artery that's compressing on the vein. So that's the iliac artery there pressing on the vein. You can see it there, sandwiching it between the spine and the artery and the spine are wedging the vein.
So I think you want to copy your stent right here. See what I'm talking about?
Oh, sure.
So,
Yeah.
So you'll end in the
So here's the top of the stent, the bottom of the stent. So you're going to see it from here. As we pull back, that stent's going to flower open and open
You got 18
in
below.
here. Okay?
18 below.
We'll be watching from here. Unless you get times right. Yeah. You can see the stent is opening. You can see the stent is opening there. Once we get here, it's the point of no return, so we're happy with that, right? Yeah. Okay. The stent is deployed. Okay.
With that 18 in or what?
Now we're going to put a balloon in there to just kind of open the stent up and really push it up against the wall. So this is the balloon. We're going to inflate it. This is a little bigger balloon than last time, so we're going to stretch that stent so we make sure that that stent is really pushed up against the wall of the vessel.
To a different position. Which is fine.
So IVC, we're coming down. There's the stent. See the spikes there? That's the stent. Good, we're coming in. Great. You can see that's the compression. No compression there. Beautiful, big, beautiful vessel there. Remember how it was sandwiched down like a pancake?
It's opposed here.
Beautiful, yeah. You can see the stent is right up against the wall.
Perfect.
And there we go. Cured.
If you have leg swelling, one leg larger than the other, chronic leg pain, chronic venous insufficiency, or leg ulcers that don't heal, you may be suffering from iliac vein compression, also known as May-Thurner Syndrome. Here at Milford Vascular Institute, we can diagnose and treat your compressed iliac vein using IVUS intravascular ultrasound, stenting, and balloon angioplasty, performed right here in our office-based laboratory. To determine if your symptoms are due to May-Thurner Syndrome, you can schedule a consultation with one of our vascular specialists by calling 203-418-7386, and it will be our pleasure to care for you.